Thank you for joining us today to hear about patient and family-centered care from a patient's perspective. Joining us is Ken Haggard, a patient who underwent a surgical experience within the health region. Ken has generously agreed to share his surgical experience story with us today. We truly appreciate the opportunity to hear about and learn from his story. Hearing about patients' care experiences gives healthcare providers the opportunity to better understand how patients and family members feel and what we can do to improve their safety and quality of care. Without further delay, Ken's story.
Hi. My story began with the completion of the FET test sent out through the screening program for colorectal cancer. The result was abnormal. After discussing with my family doctor, he referred me for a colonoscopy. For someone who had never had anything other than the flu or stitches in my whole life, this was certainly unsettling and unwelcome news. The colonoscopy was performed outside of the health region, and it revealed a mass within the colon that required surgery. Arrangements were considered for the surgery, and the surgery was laparoscopic assisted colonostomy. The surgery was scheduled within the Kelsey Trail Health region. An appointment was made to meet with the surgeon. The surgeon discussed and explained in detail the surgery, what was to be done, how long the surgery would take, and what to expect after the surgery. He had a very descriptive pictorial diagram of the colon, the intestines, and that, and showed very clearly what the surgery was to be. Also discussed the estimated time in hospital, the pain to expect, the recovery, and healing time. The discussion was very thorough, complete, and informative. I met with the nurse a week prior to the surgery to prepare and process the admitting papers, medical history, operating procedures, hospital procedures, and other required personal information. The documentation was all-encompassing, easy to understand, and very thorough. The items discussed including medications, personal hygiene, breathing exercises, leg exercises, and what to do on the day before surgery when arriving at the hospital. Family members were encouraged to attend and participate in all of the sessions. I checked into the hospital the day before the surgery to prepare for the surgery, to complete the paperwork, and was assigned to a room. There seemed to be a lot of paperwork with repetition. However, it was very thorough and complete. And looking back, I was happy for the repetition as everything was covered and nothing was left to chance or to misunderstanding. The preparation for the surgery was similar to the preparation for the colonoscopy, the cleansing of the system, plus blood work and shaving the area of the surgery. There were discussions and questions regarding the surgery, any thoughts, questions, or concerns that I might have. I appreciated the communication, assistance, and time spent discussing all of the procedures. It certainly helped the mental preparation and readiness for the surgery. I walked to the operating room, visited with the surgeons, the anesthesiast, and operating room personnel. I had the feeling that they cared how I felt and was I prepared for the surgery to come. Their concern was comforting and relaxing. I awoke from the anesthetic 12 hours later. The care and attention was very sincere, friendly, and comforting. The kindness and concern made me feel very comfortable and at ease. I was encouraged and helped to do all of the post-operative exercises, no matter what time of the day or night. At 2 o'clock in the morning was no different than 2 o'clock in the afternoon. This feeling and encouragement certainly made recovery a lot easier and maybe a lot quicker. I rested comfortably, knowing I was being cared for by those who truly cared. We all anxiously waited for the physical signs that healing was taking place. Stomach gurgling and of course passing gas. And once they occurred, we all shared relief and happiness. Numerous hospital staff dropped by just to see how I was doing and to say hello. In all, I spent 2 days in the ICU after the surgery and was released from the hospital 4 days after the surgery. One concern I have is that I have type 2 diabetes, and we manage it with insulin, medication, and pills, along with diet, exercise, and good judgment. During my stay in the hospital, my blood sugar was all over the place. Some of the food choices and meals available were not necessarily the best for a diabetic. Obviously, I would have preferred not to have had this kind of surgery. However, I was truly happy that my experience with the exceptional care, kindness, and thoughtful attention I received during my hospitalization. It was appreciated. It takes a special, caring person to work with patients in a hospital and in the medical field. In closing, I would strongly suggest that anyone who has received the FIT test should do the test and or see their doctor to discuss colorectal cancer. I did not have any symptoms or any indications prior to receiving the test that anything was or potentially wrong with me. I'm glad I went through the processes that we went through, and really the procedure is not all that bad at all. Thank you.
Thank you for sharing your surgical experience story, Ken. It is great to hear that you received exceptional care, kindness, and thoughtful attention. As a region, we value what our patients and family members have to say and encourage open communication and partnerships. Thank you very much.
You're welcome.